Welcome back. In this video, we'll talk about the most common beta blockers, their uses and side effects. These are the medications ending with the suffix lol, like propranolol, atenolol, labetalol, and ismolol. In our bodies, we have beta-1 receptors, beta-2, and beta-3 receptors. These medications antagonize beta-1 receptor more than beta-2 receptors. And as we know, beta-1 receptor is found in the heart. So they antagonize the adrenergic system in the heart, slowing it down and decreasing the heart rate. So it makes sense that we use these medications in cases of angina and supraventricular tachycardia. And these medications have equal effect on beta-1 and beta-2. Beta-2 receptors are found in our lungs, and they maintain an open airway. So beta-2 agonists cause bronchoconstriction. That's why these medications are contraindicated in asthmatic patients. Remember, beta-1 works in the heart because we have one heart, and beta-2 works in the lungs because we have two lungs. Carvedilol and labetalol antagonize both alpha and beta receptors, which means we can use these medications in cases of pheochromocytoma and cocaine overdose. This is very important to know. To remember these classes, remember that the first group of beta blockers starts with the same letter of the alphabet of the first half, and the second group starts with the same letters of the second half of the alphabets. These are common side effects of all beta blockers. This include masking hypoglycemia, as beta blocker slows the body down, which is the same effect that someone would have with hypoglycemia. Erectile dysfunction, dyslipidemia, especially with metoprolol, and cardiac depression. Here are some other uses of beta blockers. Like we said before, they can be used to treat angina by decreasing the cardiac effort, thus decreasing the need for oxygen. They can also be used in supraventricular tachycardia, as they slow down the heart and eliminate this arrhythmia. And because of their effect on the heart and renin, they can also be used to treat hypertension. They also decrease the production of aqueous humor, which is the liquid inside our eyes, so they can be used to treat glaucoma. And of course, they are the first line in preventing variceal bleed in cirrhosis patients. The first line to stop a variceal bleed is octreotide, but the first line to prevent it is beta blockers. And here's a small quiz for you. Which of the following beta blockers is preferred to prevent variceal bleed? The answer is propranolol. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.